Assalamu alaikum. Dear students, welcome to microbiology lecture. I'm Dr. Nadia Wali and this is my first lecture with you. As you have been given introduction on parasites, I'll start with a new topic, that is Plasmodium or malarial parasites. Malaria is a serious public health problem and there is also a risk of miscarriage and underweight infants at birth. Communities with high endemicity have high economic burden, lack of knowledge about malaria, poverty, and chronic disease. All of this creates a vicious circle. By the end of this session, you should be able to describe various modes of transmission, various species of Plasmodium, vector, life cycle, pathogenesis, clinical features, complications, and laboratory diagnosis of malaria. Classification of parasites. Parasites are broadly classified into protozoa and metazoa. The metazoa further includes phylum and classes, so we are not concerned with this metazoa category at the moment. In protozoa, there is a group which is called as sporozoa, and malarial parasites are included in this particular group because they produce sporozoites. Malaria is a combination of two words. Mal means bad, area means air. The vector is female Anopheles mosquito. Plasmodium is a genus and the genus always starts with a capital letter. Falciparum, vivax, Wali, malari, all of these are species. And the species always start with a small letter. Though the primary mode of transmission is mosquito bite, but there are also other modes of transmission, such as through syringes, infected syringes, I must say. So malaria in drug addicts can occur through the use of same syringe when one of them is infected. Similarly, transfusion malaria can also occur during the course of blood transfusion, when infected persons having latent malarial infection are used as donors. Congenital malaria, though it is rare, but there is transmission of infection to fetus in utero through some placental defect. Now let's talk about life cycle of Plasmodium. Mosquitoes are the primary host and the sexual cycle will go about in mosquitoes, whereas there is asexual cycle in humans and they are the intermediate host. Now let's first talk about the asexual cycle, which is inside the humans. Now there are two phases. One is called as a tissue phase because it involves liver. The second one is going to be inside RBC, so this is also known as erythrocytic phase. The tissue phase also involves the pre-erythrocytic or primary exoerythrocytic schizogony, and the pre-erythrocytic means it is just before entering the RBCs, or exoerythrocytic means that it is outside the RBCs. Then this phase also involves the formation of hypnozoites, but only two species form hypnozoites, Plasmodium vivax and Plasmodium ovale. They remain dormant inside liver and these are called as hypnozoites. The erythrocytic phase involves erythrocytic schizogony, and in this phase the merozoites would undergo different morphological changes and finally the RBCs would burst and these merozoites would re-enter the new RBCs. So we'll talk about this in detail in the upcoming slide. And then is the gametogony. Sometimes the male and female gametocytes are formed. And now I'll show you this illustration. If you're able to understand this illustration, rest of the task becomes easy for you. Now let's start with this mosquito bite. So these sporozoites, which are these elongated structures, they are injected and they reach the liver cell where they are going to form schizont. Now this schizoid is going to have merozoites, some are smaller in size, some are bigger in size. The bigger in size are known as macromerozoites, which are going to return to liver. And if you remember, I had just talked about the hypnozoites, Plasmodium vivax and Plasmodium ovale. Both of these are not immediately going to become liver schizoids. Instead, they are going to hide themselves, or they would become dormant inside liver. And they are known as hypnozoites. And by the way, they are responsible for clinical malarial relapses. Okay, now the small sized merozoites, which are known as micromerozoites, they're going to enter into RBCs, and from here the erythrocytic phase would start. Initially, it was pre-erythrocytic or primary exoerythrocytic phase. Okay, so these merozoites would now undergo various morphological changes. The first change, or I would say the morphological change, is the immature trophozoite stage, also known as the ring stage. Just try to remember this with the ring having a single diamond. And then it will mature, this trophozoite, and finally the schizoid is formed, and lots of merozoites would be released once the RBCs are going to burst. And because of this, there is hemolytic anemia because of many RBCs, they rupture. The merozoites are again going to find their way to new RBCs, and the cycle would be repeated time and again. Now, at times, what happens? These merozoites, instead of entering into this erythrocytic cycle, they enter into gametogony, and that is to say, they form male and female gametocytes. So, whole of this cycle is the asexual cycle or the schizogony cycle, whereas this sexual cycle or this sporogony cycle would occur inside the mosquito. Now we are going to start this sporogony cycle. Now the mosquito would ingest both the sexual and asexual forms, but just the sexual forms would further develop, and now rest of the process, or you can say the developmental process, would take place in the midgut of the mosquito. Now the female macrogametocyte, just one macrogametocyte would give rise to one macrogamete, and the microgametocyte, which is the male one, is going to have lots of flagella and forms a number of microgametes. The microgamete, they fuse to form zygote. Zygote lengthens to form ookinete. Ookinete forms oocyst. And once division is going to take place inside this mature oocyst, the sporozoites are produced. And these sporozoites are going to reach to the salivary gland of the mosquito, and then this cycle would be repeated inside the humans, which I've just explained. Please remember, the exoerythrocytic cycle is not responsible for clinical attack of malaria, and you cannot find any of the forms inside blood. Whereas if you talk about this erythrocytic schizogony, yes, you can find various asexual forms inside peripheral blood film, and this phase is responsible for clinical attack of malaria. And by the way, you can also find gametocytes inside peripheral blood film, though it cannot produce any symptoms. Okay, this is the text version of what I have just explained. The sexual life cycle, so the gametes, they would fuse to form zygote, ookinete, oocyst, and finally the sporozoites are produced, which is the end product that we require. And then is the asexual life cycle, the pre-erythrocytic phase, in which the sporozoites would form liver schizoids, merozoites, and the Plasmodium vivax and ovale, they are known as hypnozoites. So no clinical attack of malaria, you cannot find any parasites inside peripheral blood film. The erythrocytic uh, Schizogny and Gimetogony. Now, the trophozoites would mature and will form schizones, and again, merozoites would enter into new RBCs, and this is the particular phase where there would be clinical attack of malaria, and you can find these forms inside peripheral blood film. I will cover pathogenesis, clinical features, complications, and a laboratory diagnosis of malaria in my next lecture. So I'm going to stop till here. Thank you.